Hello, and welcome to today's webinar, The Cost of Healthcare System Complexity. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded, and an online archive of today's event will be available a few days after the session. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing Enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. We're very fortunate to have with us today J.P. Steffen, Renee Gent, Sean Wagner, and Julian Feely. And at this time, I would like to turn the floor over to JP to introduce the presentation and panel participants. Welcome.
Thank you, Monica. Welcome, everyone. My name is JP Steffen. I'm with Accenture. I'm a managing director at Accenture, and I lead our health customer engagement practice. I help our clients transform their organizations to better engage their consumers. And today I have the pleasure of being your moderator for this discussion around healthcare system literacy and complexity. We have a great agenda in store for you. We'll have three parts. First, we will share insights and research from Accenture's latest study. Secondly, I will be moderating a panel discussion around this topic of healthcare system literacy, taking three different perspectives. One from a leading healthcare organization, secondly from an innovative full-stack insurance startup, and lastly from insightful consumer and industry research. Lastly, we will wrap up with Q&A. And as Monica mentioned, throughout the presentation, you can type in questions and we'll look to address those at the end of the discussion. And so now I'd love to introduce our panelists. We have Renee Gent with Aetna, a CVS Health company. Renee serves as the Chief Digitization Officer at Aetna. She is charged with both reimagining and reinventing the constituent experience across the Aetna organization, leveraging data and digital technologies. Renee has an extensive background in IT and digital solutions, and she is committed to embedding a digital-first mindset across the organization. We also have with us Sean Wagner. Sean serves as Bind's Chief Revenue Officer. Sean co-founded Bind a few years ago with a small group of innovators back in 2016. Prior to founding Bind, Sean led a healthcare technology company that was later acquired by United Healthcare. Sean also served as an officer in the U.S. Army and in the Iraq war. So, Sean, thank you for your service and thanks for joining us today. Last but not least, I'd like to introduce Julian Feely. Julian is a business strategy manager with Accenture. He specializes in growth, customer engagement, as well as innovation. Julian is a key contributor to Accenture's thought leadership and research, and he will be sharing our research here on healthcare system literacy. So with that, thank you for joining us, and I'd like to turn it over to Julian to share those consumer insights.
Thank you, JP. In terms of brief background on the research, so there's a lot out there, and a lot of it has been studied in terms of the subject of health literacy. What we really wanted to focus on here was healthcare system literacy specifically, and the ability of consumers to navigate the complex system to get their care needs met. So there's a lot of data and information on the following slides that we'll go through, but I want to structure it around three key insights about the behaviors of consumers with low healthcare system literacy, the impact that has on our healthcare system in terms of cost and spending, and then some of the underlying drivers of those behaviors that will lead us into recommendations moving forward. This research is largely based on a recent study of over 12,000 US healthcare system consumers. And one of the key areas that we asked them about was their understanding of the healthcare system in terms of being able to correctly define common terms such as premium, deductible, and copay, and if they understood core concepts such as the difference between in-network and out-of-network. And the goal of all this was really to understand their ability to navigate the system to get their needs met. Based on that research, we've segmented consumers into 4 groups around healthcare system literacy: no experience, novice, proficient, and expert. And we've been running this study for several years now. And if you look at the left-hand side of the page for 2017, you can see that there's a pretty even split between what we've categorized as low healthcare system literacy consumers, those with no experience or who are novice, and then high healthcare system literacy consumers who are either proficient or expert. If you look to the right-hand side of the page and you fast forward to 2021, it's a very different and changing picture. So today, more than 60% of consumers have low healthcare system literacy, and conversely, fewer than 40% are highly literate in the system. If you do the math, that's a 20% decrease in health system literacy over just the past few years, really, based on the same survey asking the same questions. So the first insight I want to talk about is we looked at the behaviors of those with low healthcare system literacy, and one thing that stood out is they are much more likely to have used the emergency room for care in the past 12 months. When we did the analysis, we broke it out based on those with chronic conditions on the left-hand side of the page and those who are generally healthy on the right-hand side to make sure that the differences in use of the emergency room weren't being driven by health status. And if you look at the data, so if we start on the left with chronic consumers, you have low healthcare system literacy folks in purple, those with high system literacy in gray. And for chronic consumers, those with low system literacy are twice as likely to have used the ER. If we look to the right-hand side for those who are generally healthy, naturally overall use on aggregate of the ER is lower, but actually the difference between those with low and high system literacy is even more pronounced. So when you round the numbers, those who are generally healthy but have low health system literacy are about 3 times more likely to have used the emergency room for their care. The second insight I want to focus on is that there's a tremendous cost and spend impact tied to low healthcare system literacy. We honed in on one area of that around use of the emergency room and identified that there's nearly $50 billion in annual avoidable medical spend across the United States. Again, with this analysis, we segmented the data based on those with chronic conditions or those who are generally healthy. And if you look at the page, the darker purple is the current emergency room spend of those with low healthcare system literacy. And then the lighter purple is the spend if those consumers used the emergency room at the same rate as those with high system literacy. So what we're doing here is we're controlling for the impact of low system literacy on use of the ER and seeing what it would look like if that were removed as a factor and as a barrier for the way that consumers make decisions about their care. So to do the analysis, we assumed that excess emergency room visits among those with low system literacy would be diverted to other more appropriate channels like the physician office or urgent care or virtual care. And if you look at the page, that drives $42 billion for chronic consumers, an additional $5 billion for those who are generally healthy. So that adds up to the $47 billion annual avoidable medical spend if low system literacy is removed as a factor. The third insight I want to focus on is really the key question here of what's driving this difference? Why is this happening? And ultimately, the data shows that those with low system literacy are using the emergency room as the path of least resistance. It's become the default in a complex system where options aren't clear. So if you look at the data and some of the specific drivers, and you look at the differences between those with low or higher healthcare system literacy, those with lower literacy in purple here really feel that they don't have the information to find the doctors or the treatment that they need when they need one. They can't use their preferred channel to find care. They feel it takes too long to get care. And so in a world like that, the emergency room stands out as a clear option. It's always there. It's dependable. It's always open, and you know that you can rely on it on your care needs when outside of that, there's this broader complexity throughout the healthcare system. So in terms of the path forward, so when addressing this, leaders should focus on 4 key areas that were identified based on the research. There's simplifying and innovating product designs to try to reduce the healthcare jargon and the complex rules that consumers need to understand to be able to navigate their care. There's driving price transparency to make options and choices clear and create more of a shopping experience that consumers get in so many of the other industries that they interact with. It's driving provider collaboration to align incentives and help make patient options clearer, closer to the point of care, where providers have a lot of influence, and making sure those communications and directions are aligned. And then lastly, underpinning all of this with human-centered design, creating a more intuitive system and interweaving that with all of the other areas on the page. And instead of molding consumer behaviors to a complex and legacy healthcare system and trying to train them to be able to navigate it, really looking at ways to truly redesign the system so that it works for consumers. So to conclude with the upfront research component of this, we talked about the growth in low healthcare system literacy. We discussed the impact this has on consumer behaviors and greater use of the emergency room as a default for care. We talked about how that drives spend and cost in the overall healthcare system. And then we talked about some of the underlying drivers of these behaviors and the recommendations moving forward. So with that, JP, I'll hand it back to you to open up our panel discussion.
Well, awesome. Thank you, Julian. A lot of information there to unpack. We'd love to engage now in a dialogue around these findings, really thinking of unpacking these in 3 parts. First is really understanding the problem. What challenges do we face with healthcare system literacy? Secondly, let's talk about solutions, either existing solutions or future solutions. And then lastly, I'd love to hear from the panelists how we think about the future and the go forward path. Before we dive in, Monica, I would love for you to perhaps reiterate how to post questions. I see that we have over half a dozen questions posted already just throughout this discussion, so we could seek to field those at the end.
Yes, thank you. As a reminder, you may ask a question at any time during this presentation or during this panel discussion by typing your question into the Q&A box located on the right side of your screen and pressing enter, and we will address the questions at the end of the webinar. Thank you so much.
Great. Thank you, Monica. Well, for the group, what are your initial reactions? Renee, I know that this has been a topic of discussion in the industry for quite some time. What are your reactions to these insights?
Yeah. Well, first, thanks to JP for having me here. I'm actually looking forward to a great dialogue with Sean and Julian. So first I'll say this, maybe three things. One reaction and then a couple observations. First, not surprised, right? This is an industry-wide challenge, and I don't think that this data probably surprised anybody. So I would say that number one, I don't think it's a big sort of surprise. There was an earlier slide, I think one of the first slides that Julian shared, which really talked about sort of the proficiency of the population. I think Sean and I had actually commented on this earlier when we were prepping, but I'm actually surprised at how high that percentage was, right? So it was, I think, 13% expert and 26% proficient. If you think about that, 39%. So even though it went down, right, from 17 to 21, that's still a pretty high percentage. So maybe that's optimism. Maybe that's just sort of how the survey hit certain populations. But I would say that certainly was one observation. A really quick maybe little story. So the last year or so with COVID, right, we all have experienced electives getting put off, right? So members doing less finding of care, right? So there was an interesting observation in here in some metrics around, individuals having noted that finding care, right, my healthcare company isn't helping me find care. Well, during COVID, when that care sort of was not being used as much, our NPS score, which is a measurement of consumer satisfaction, actually went up. So we saw a direct correlation of less people finding care during COVID, right, for those electives, and actually, bumping up our member satisfaction. And then I would just say, lastly, my last observation is I really loved the four sort of C-suite recommendations, because they're all things that we're focused on. We've been focused on them for the last couple of years, and we've got some really good momentum behind them. So it was nice to see a little bit of that validation.
Awesome. Well, thanks for sharing that, Renee. Sean, your perspective as a company that's looking to rewrite how we do healthcare insurance, what are your reactions to the insights?
Yeah, sure. So again, thanks for having me, JP. Proud to represent Bind and all we do for thousands and thousands of Americans as we speak. So both as Bind and just as an innovator, whether you're innovating external and starting something new, or you're part of a larger organization and you're an entrepreneur, I think the findings, I would call these findings gold. So these findings say to me nothing but opportunity. So, and especially when you think about these findings and their downward trajectory, they're not heading in the right direction, which means they're even more golden. So as either an entrepreneur or an entrepreneur, this is a huge area of opportunity. That's what I would be taking away from this. This is a huge area of opportunity. Now the challenge is, how do I turn this opportunity into something that is valuable to the entity I'm either creating or the entity I'm supporting in innovation?
Mm-hmm. Yeah, that's a great point, Sean. The trend wasn't headed in the right direction, and over a decade we've seen whether it's startups or innovators or even organizations from outside of health looking to disrupt this. What makes it so challenging to navigate this complexity? Sean, I'll just follow up on your initial remarks there. What makes it so challenging? Why haven't we cracked this nut yet?
Sure. So I guess I'll just pick up on what I closed with, which is the biggest challenge in any opportunity is how do I monetize it, essentially? And monetization goes back to business models. I was fortunate to be able to learn business model thinking from the great disruptor Clay Christensen, and his point of view was everything comes back to business model. And the challenge I think to date with health system literacy is how do I couple improving it with a business model that I can get investment behind to the tune I need to sustain the innovation, because it's going to take more than a couple months to crack this problem. So I need to align a business model to the opportunity. Today, if you just look at the value chain and the business models, I think the current business models are thriving in spite of this challenge. So if you look at quarterly earnings from for-profit provider systems or for-profit health insurance entities, if you look at not-for-profit 990s, the business models are not, they are not in a downward trajectory. They are thriving. So the challenge here, I believe the fundamental challenge is how do I connect this opportunity to the business models that are in play and show how I can improve the performance of the business model by investing in this, or I have to think of a new business model to monetize this opportunity. So I hate to use a crazy term and big term like business model as a fundamental challenge, but I do believe that Clay Christensen was right, that it all comes down to business model.
Well, yeah, I mean, Sean, that's a very interesting perspective you bring, because so often we try to solve it solely with technology or solely by trying to address the experience layer, perhaps of that technology or operating model, but we don't necessarily seek to address the business model, which is a fundamental change. As an insurance company, Renee, just interested in your reactions to Sean's observations there.
Yeah, I couldn't agree more. I feel like, we do try at times to lead through technology, and we've got to start with our business transformation. So, reinventing, reimagining, those are two words, right, that we're hearing a lot around how do we sort of, take this into the future. I think a few other sort of things that I would add around what's driving the complexity here. First and foremost, I actually think a big part of this is consumer choice that is really leading to the complexity of products and benefits. Let's think back probably to many of us on this call when we were, growing up. You would go to your family doctor, right? We didn't call him a PCP or even primary care. It was you went to your family doctor. And it was pretty simple. It was a $5 copay. You went to the doctors, it was a $5 copay. You went to the pharmacy, it was a $5 copay. You went to a specialist, maybe it was a $10 copay. Well, today, right, with all of the consumer-driven health plans, the federal regulations that are out there, we have to build for every, exception. It's just a fact that our products are so much more complex, not only for our members, but also for our providers, for our customer service reps, for those, folks that are selling. It is just, we've sort of created this complex product environment because it allows for flexibility and choice. So, I would say that that's one thing driving complexity. The other thing that I want to just spend a minute talking about is sort of this comorbidities, right? So there was just a recent study from the CDC that said 6 in 10 adults have a chronic illness, and 4 in 10 have more than 2. So think about that. No longer just a member, an individual who has an illness and they're trying to navigate this healthcare system. They're trying to deal it with 2 and 3 and sometimes 4 different, illnesses that they're trying to, sort of navigate. I'll share just a really quick story to hit home on this. Now, I've lived in the healthcare environment for 32 years. I've worked at Aetna for 32 years. I've worked in technology. I get the ins and outs of the system pretty well. I had a sister-in-law that I lost about 4 or 5 years ago, and she had a brain tumor. But she also was a diabetic. She also had a neck fusion. She also was depressed. She also had a mental illness. And it was myself and my family that navigated her healthcare system for her and her journey. None of the data and the doctors were connected. We had to bring the list of prescriptions from doctor to doctor. So I think this living in this world of, comorbidities and an already complex healthcare environment, I think is also really adding to it being really hard to navigate this system.
Yeah, and it comes back to the product, and it's not just the financial product, right? I mean, and thank you for sharing that story. It's our health, it's our loved ones. So it goes beyond just an insurance product or a financial instrument to impacting individuals. So thank you for sharing that. Julian, when we looked at the research you shared from 2017 to now, the trend has gone in the wrong directions, in the wrong direction. What impact did COVID have to that? Is that a reason for the increase in low literacy, or what's your hypothesis there?
Yeah, that's a great question. Because if you look at that change from 2017 to 2021, an obvious idea to fall back on is that COVID has made healthcare system literacy worse. But it turns out that's not actually the case. When we look at the data, because we've run the analysis every year, it's just steadily decreasing year after year. There's no jump or substantial difference in the trend between 2019 and 2020 after the onset of COVID-19. Similarly, it's not as if COVID is driving higher use of the emergency room. Most studies actually show that ER use in 2020 decreased relative to prior levels. So it seems that it is a fully separate issue in and of itself. Of course, COVID impacts it, but it's not being driven that way. The only other piece of data that I'd just briefly highlight is that there does seem to be a relationship between health system literacy and vaccine hesitancy. So those with the expert level of healthcare system literacy, or those in that segment, are 25% more likely to either have received or be planning to receive the COVID-19 vaccine relative to those with lower system literacy. So it does have a relationship to some of the broader questions about vaccinations that will impact the healthcare system and utilization moving forward.
Yeah, so thanks, John. So to Renee's point, products aren't getting simpler. Our data is showing that one of the impacts is this literacy and then the behaviors. Sean, you highlighted the fundamental issue of our business models in the system. Sean, what else could be contributing to this decline? Any perspectives there?
Sure. So I think, going back to Renee, I mean, when you look at the product evolution, we continue to increase deductible layers. We continue to rely on co-insurance layers, and we now start to run out of room there. So we start doing things like narrowing choice on the provider side, narrowing networks, which only further complicates the situation. So I definitely think the product construct has continues to create challenges for people. And then on the flip side of things, if you're on your phone and you're trying to figure out what should I do about something, and you go to the local provider organization that you have either in your neighborhood, you know a family member that works there, whatever, but you have some affinity to them. I haven't really seen a lot of attempts by the provider side either to say, hey, don't come to my emergency department. In fact, you see oftentimes an opposite. Come to my emergency department because my wait's only 2 minutes, right? So again, I don't think I hate to keep going back to business model, but I think that there are challenges in the product innovations that we're seeing are not trying to change this. So I mean, throwing up a dashboard on the wait time to the ED is not helping get people to the appropriate side of care. So I think we have challenges in the innovations people are putting forward. They're sustaining the business models of today. And we get what we design for, always.
Right. Yeah, so it comes back from an insurance perspective back to the product. And I know, Renee, a big focus over the past several years has been make the language consumer friendly and make it understandable to the consumer. And it sounds like there's something more fundamental around changing product. Why is it so difficult to change product in this industry?
Yeah, so I think there's multiple factors. Let me just kind of put a few out there, and I'm sure I'm missing a whole bunch, but just from my sort of experience here, one, a lot of federal regulations, right? There is just so much that is federally regulated, and on top of that, you know, a significant portion of our clients, our plan sponsors, are what we call self-insured, right? So they drive that sort of, you know, what they want. You know, they're assuming the risk, right? They're assuming that for their employee base. So there's always sort of this, well, here's what we're, you know, able to do from a regulation perspective, and then, well, here's what the plan sponsor wants to do, and then not within Aetna, we're a 160-year-old company. It's really, really hard to change those legacy systems, right, for an existing product. So it's easier to actually create a brand new product, but then you still have, you know, sort of all of those other challenges. But product changes, product innovation, product design in systems that are, you know, several decades old, it's hard, right? And there's a cost. And I think, Sean, you mentioned this a little bit earlier when you're talking about sort of business model. I mean, it's hard to do. It's expensive to do. And although we tend to make small, I'm going to say, improvements there, I go back to sort of the reimagine, the redesign, the reinvent that needs to happen. So, you know, I think that we're started, you know, on a journey to get there. We're actually starting to think about more of a modularized, simplified product. But there are definitely several barriers in place to do that quick, right? I'm not saying it can't be done, but to do it quick and to do it at a cost that, you know, is acceptable is really hard.
Yeah, that's a great perspective. Julian, you described the impact on one behavior of ER usage. What are your thoughts on the other impacts, whether it's cost, medical cost, or administrative cost? What are some of the hypotheses we have around the potential impact of low literacy?
So we've done research and analysis to show the impact on at least one area of administrative costs, and it's also significant. So as you might imagine, those with low health system literacy, they clearly have more trouble navigating healthcare. They have more questions that need to be answered. And one way this manifests is that they tend to call customer service much more often. And we looked at payer customer service use specifically. And it's much higher than their than their peers with better healthcare system literacy. This cost has also started to balloon over recent years. So in 2018, we had attributed about $5 billion annually just on the payer side that we were looking at in terms of costs attributed to customer service use among those with low healthcare system literacy. Looking at the latest data and analysis from 2021, it's about double to over $10 billion because there are a greater number of consumers in that lower healthcare system literacy category, and the difference in behaviors actually seem to be increasing as well.
Yeah. And you've been qualifying it as just the payer side. You can imagine that on the provider side of the system, they're also receiving customer service calls on billing, coverage, etc. And not to mention the administrative cost of it, but who wants to call customer service around a bill or coverage? So, okay, so we've rolled enough in the problem. Let's move forward to the solutions. So we've talked about product being at the center of this. Sean, you introduced Bind as essentially looking to reinvent the health insurance product. Can you tell us a little bit about what opportunity Bind saw with the health insurance product, and maybe address some of your business model concepts? How are you rethinking health insurance?
Sure. So those are all very bold statements, and I certainly wouldn't posit that we have done everything. So these things are like 20, 30, 40-year arcs here that we're talking about. So even though that bold statement is out there, we recognize that we've got dozens and dozens of years here to do this. But I guess from a perspective of where do you start, I think expecting people to all of a sudden have a breakout of health literacy with concepts that really don't make a lot of sense to them, we thought probably not a good idea. So if you're going to change health insurance, you probably need to actually change the product itself. You're not going to navigate or concierge your way out of this. You're not going to tech stack your way out of a bad insurance product from a consumer perspective. Co-insurance that gives me certainty only after I've already made a decision and consumed things, and then later I understand what my financial result is, that just fundamentally is not a good concept if you want to get people to make decisions that benefit themselves and you as the risk bearer. So we did away with things like co-insurance. Deductibles, from a risk pool perspective and utilization, yes, they do change utilization patterns. Sometimes that's good, reducing the use of imaging for headaches, good use of deductible. Reducing the amount of people that have diabetes going to see their endocrinologist to titrate their meds, that's not a good use of a financial incentive. So we removed deductibles as well. And when you do that, you're able to take advantage of what we always believe in, which is we believe that in people. And we believe that people, if they feel comfortable and they're given information that's valuable, they will make good decisions for themselves, and those decisions that benefit themselves will benefit their employer if they're a self-funded plan sponsor, benefit their health plan if they're on a fully insured plan through their employer, or if I'm an individual product, and the risk pool there by the insurance company. So that's the fundamental nature we strove to dig into. Was there is a tremendous opportunity here. The products of today lend a consumer unable to make decisions. And it's not that they're not able to make them, it's that they're not given a product by which they can actually be informed and make decisions. So we've reversed that and said, let's start with a product that people feel confident in, they understand it. It's just a product with a bunch of copays or price tags. There's no deductible, no co-insurance. And when you do that, people can say, oh, I get that. It's like it used to be. I got an insurance card, I can access care, and I pay when I access care. And then when you start with that, you can layer on what people want, which is In today's day and age, I want it personalized to me, and I want to grab my phone and learn things and see information. And you can do that when you remove coinsurance, deductibles. You can render something in a search box, a result, and people can see information and make good choices. So that's what we saw as an opportunity. That's what we focused on, and it has worked quite well.
Great. Thanks for sharing that, Sean. So really at the center, sort of redefining the product. And Renee, we've talked a lot about product, but to pull this off, it requires, within a health insurance organization, other departments. You have operations, you have digital, you have technology. What's required to coordinate this and make it easier on the consumer within an organization?
Yeah. So the first thing I would just put out there is we have got to move away from transaction-based, and we've got to move to experience-based. And that is something that we've actually done. As you can imagine, within Aetna, not even in the broader CVS enterprise, but we're about 55,000 employees within Aetna alone, a $70 billion company. So when you think about all of the different organizations that need to come together, historically, everybody has been sort of off on their island and doing their own thing. We made a very deliberate decision to actually form the new Aetna digitalization organization that I lead, and our focus is on member, provider, the experience of those constituents. And we do that with a lens that it has to be connected, it has to be personalized, and it has to be something that we look at holistically across all of our lines of business. So even though today we run a government business with Medicare and Medicaid, and we run our group business with commercial, my team is responsible for working across all of our business lines and creating a single experience roadmap. It is no longer what are we going to fix over here in maybe, when they call customer service. It's no longer what are we going to fix in the payment aspect. It is, let's take that journey. Julian mentioned earlier human-centered design. So important. Human-centered design, we use that design thinking, put the consumer at the center of every decision you make. What does that experience look like for that individual? I would also say that our agile sort of, practices allow us to do this. We work really, really closely with our analytics team and our data team and our digital team, our IT organization. But the shift that we're starting to make now is it's not a whole bunch of little individual projects and everybody's off doing their own thing. We have a strategy. We have an experience that we want to have for our members and or our providers. And we have a prioritized investment, and we have a governance process around it that allows us to look at it holistically across the organization. I will say it has not been easy. It's been a hard year. This is a fundamental shift. Sean mentioned earlier sort of business model changes, operating model changes. This is something that it's a cultural change as well, right? Everyone wants to kind of own their own thing. You've got to, bring all of that together. So we've been successful in the start of our journey, but it's been sort of year one of bringing this organization together. We also, I mentioned earlier, we're a really big company, but we have to use that to our advantage as well, right? Size and scale, right? We've got a ton of data. We've got a lot of insights. We've got an entire enterprise insights organization that helps us understand voice of the customer and helps us in how we, think about prioritizing the things that we need to implement. So moving away from all these individual transaction-based priorities to thinking about the members holistically and what does that experience look like at the end is really where our focus is moving forward.
Yeah, that's a great point. Several points there, Renee. And Sean, like your comment around business model, what you're describing is a fundamental operating model change that needed to happen with your organization and how you approached investments and initiatives, which is difficult. Can you share perhaps some learnings from some of the initiatives that you've implemented, or what can you share with the group in terms of some of these early innovations that you've sought to implement in the organization. Renee, if you can share.
Sorry. Yep. Sorry. I thought I was going to Sean.
Yeah. Give me a pause for a drink. Thanks.
Yeah. No. All good. So I would say, first, I mentioned this earlier, it's really hard. It's really, really hard, and you need to acknowledge the amount of deliberate focus that it's going to take. And you have to have buy-in from across the organization, because this type of initiative is not just one organization's success or failure, right? We have an organization now where I'm helping to lead and accelerate, but this is, right, they say it takes a village. So number one, just acknowledge how hard it is and make sure that you have the buy-in to do it. Second, learning is all of our members are so unique. They all have different needs. A Medicare member is so different from what a 28-year-old individual member, right, really healthy out on the exchange, trying to just find a basic insurance product. Understanding the needs of our members is so important. Personalizing that experience for those members is so important. And I would say really understanding intent. So we're spending a lot of time understanding intent, talking about how complex it is to navigate the system. What if we understood for every interaction a member was having with us, whether it's on the mobile app, whether it's calling up, picking up the phone and calling customer service, what if we, through data, through AI, what if we had a really good idea as to why JP was calling? We could service that member or that provider so much better if we had intent-driven, data around that interaction. So I'll give you a great example because, so often we're focused on cost takeout, right? We got to reduce phone calls. Every phone call costs us X number of dollars. So let's go implement a whole bunch of technology. Let's put bots in place and let's reduce a phone call. Well, guess what? If Renee was just diagnosed with cancer and I need to call in to get some information, I don't want to talk to a bot. I don't want to hear a bot picking up the phone, right? I want that experience to be that we just got a claim in from Renee. We know she was just diagnosed with cancer. The next call that comes in, we're going to get her to the best darn care agent that can help her, and not send her to the bot just because it's a more inexpensive path for the transaction, right? Moving away from that transaction and more to the experience. I already talked about sort of voice of the customer. We use data and analytics and insights, right? You can have as much data in the world. You need to understand the insights into that data to help drive decisions. And then lastly, I'm going to end on trust. I think trust is something that we're just starting to hear more in the industry talk about. We have really thought about trust. Right now, our members have a trusted partnership with their providers, not with their healthcare company. And we need to sort of build that triangle between the member, the provider, and us as their healthcare company. We've got to do better. And I think when we do that, everything becomes a little bit easier when there's trust.
Those are great insights, Renee. Thank you. Sean, what have you seen as successful that you can share with a group around making a change here?
Sure, and I guess major kudos to Renee for pulling off what she's pulling off in such a well-established organization. So kudos to you for all that you're doing, Renee. Our challenge was different. We started from a whiteboard, so our challenge was collecting funds to support the things we wanted to do off the whiteboard, and going back to just building off the product. So again, from a consumer perspective, no consumer is going to say, give me more deductible. No consumer is going to say, give me more co-insurance. No consumer is going to say, limit my choices from the network. So we have a broad network with really just prices and copays. And what I talk about is the first experiment we ran and to try to prove out was that If you give people a product they can understand, they'll make good choices. And really what I say is we're taking advantage of two superpowers of Americans, which are they can use Google search and they can use Amazon, Target, whatever shopping site. So if you were actually able to create that for healthcare, what would happen? And so we did that and we tried it, and we basically put out a product that allowed people to pull their phone out. They can pull up a search box, they can type what they're dealing with, and then we can give them options to consider. And it goes along with trust, Renee. So I'm glad you mentioned that, which is how far can we take this? So the first trust building exercise was if we can just give them certainty on and answer questions about coverage, so we can have a definitive yes, no on everything they ask us. Is this covered? Yes or no? We tell them yes or no. That was one. Mm-hmm. The second thing was, okay, now that you've told me if it's covered, well, now what might I consider doing for what I am dealing with? And then third, which is, okay, based on those options, how much will those options cost me? Because that's really what I care about, is how much is it going to cost me. So we put that out there to see what happened. So again, we now have a benefit where people can pick up their phone, they can search like Google, and they can get results like Amazon. And then they can make choices. And just something as simple as I'm dealing with a headache, or I'm dealing with sinus infection or earache. So typing those types of things in a search box, and then our result set shows, sure, you can go to the emergency department. That will cost you $500. You could stay in your own house, talk to a doctor virtually, and you could pay $5. Up to you, but I'm clear with you on your options. And what do we see happen? We see that the use of emergency department services on Bind's membership base is 30 to 40% less than benchmark. Whereas we see the use of virtual care on the Bind benefit 3.5 to 4 times benchmark. So just really making this easy for someone to interact with in the time of need and get information. If you give them information that's useful, they'll take advantage of it and make good choices. So I gave you an example of ED. It's the same thing as for more complex things. So I have knee pain, I have back pain. You can go see an orthopedic specialist if you want. It will cost you $50 for people we see with great results. It'll cost you $90 for those where we see having more rework, hospital-acquired infections, etc. Or you could go get physical therapy for $5. Again, what do we see on a Bind plan? We see the use of elective procedures drop 35 to 40%, and we see the use of physical therapy jump 70 to 80%. So again, it goes back to what was our bet? Our bet was that if you give people a product they could understand and information in a medium they like to consume it, their cell phone, they will make better decisions. And lo and behold, what Bind has seen over and over again is that better decisions are made. And it drives tremendous satisfaction. So we do a product market fit test where we ask people, if Bind went away, how disappointed would you be? None or very? And over 80% of people said they'd be disappointed if Bind went away. So they're happy with the product. And then from a financial perspective, the average out-of-pocket spend for someone on an employer-sponsored plan is over $1,000 on average. At Bind, it's under $500. So they like the plan for it's helpful, and financially, it benefits me as well. And we save our clients, upwards of 15 to 20% on their overall spend. And it really just comes down to people make better decisions. It benefits everybody.
That's
so
great.
It works.
Very tangible examples. Thank you, Sean. Well, I know we have quite a few questions in the Q&A. Before we transition to some of your questions, we've talked a lot about the problem in terms of product, business model, legacy systems, the solutions of simplified products. Renee, you mentioned this transition from being transactional to experience with an emphasis on understanding intent, as well as the operating model change that's required. What lies ahead? Renee, would love your perspective on sort of the path forward on this issue.
Yeah, so here's what I would say. One is, Sean mentioned this earlier, we're ripe for opportunity. I don't think there's a more opportune time or an exciting time to be in healthcare and in technology, number one. it's going to take a collective industry priority for us to get to where we need to be. We're going to need our large payer systems. We're going to need our large provider systems. We're going to need companies like Sean. We're going to need technology. It all needs to come together into a sort of single mission, right? And I think all of us should be focused on the mission, which is to improve the health of the population, right? And with that comes reduced medical costs, et cetera. I know there's a lot of regulation out there. There's the interoperability. I think there was a comment in here about the No Surprises Act and the impact that that's going to have in transparency. I think that's going to force and accelerate a lot of the bidirectional data sharing, which will definitely, get us a little bit of the way to where we need to be. I would leave sort of my thoughts here. We actually have something that we call in our member experience gaps that leads to trust. And the gaps is, the G is to guide. We need to guide our members. The A is to anticipate. How do we leverage technology, AI, et cetera, to anticipate the intent? I spoke about that earlier. The P is personalized. Everybody's healthcare journey is personal, and how do we ensure that we're supporting them on their personalized journey to good health? And then finally, simplify, the S. We've got to break down the complexities. We've got to simplify it. And we feel if we can close those gaps, guide, anticipate, personalize, simplify, it will lead to trust and we'll make some really good progress. But it is going to take the industry for us to get there.
Thank you, Renee. Very compelling perspective. We have quite a few questions. Love the level of engagement. We'll try to get to as many of them as we can. There is one in here, extremely interesting findings. Thank you. Did you stratify your research by managed care products? Julian, I'll turn that question over to you.
Yeah, great question. So we certainly broke out the data based on payer line of business. And what we saw there was that actually the highest proportion of consumers with low health system literacy are actually in group as a line of business. When you look at the biggest differences between those with low system literacy and high system literacy, it's in the individual market and Medicaid, where there's a higher proportion falling in the low healthcare system literacy side of things.
Thanks, Julian. What about, there's another related question around, was there a control for college or higher education or career? How do we think about education level as it relates to literacy?
Yeah, so another good question, and it is something that we looked at in the research. So when we looked at the data, it became really clear that traditional education is not what's driving healthcare system literacy. 98% of those with low system literacy have at least a high school degree. Over 60% have either graduated college, graduate school. So it's really not about traditional education or trying to, teach people more or, teach them to better navigate the system. It's really this separate, entrenched issue of complexity, making it difficult to navigate healthcare pretty much no matter who you are.
Great, thank you, Julian. And it looks like we're bumping up on time. Very engaging discussion. Thank you to all our panelists. There were some questions around the research being made accessible online. We will work with AHIP to make these slides accessible. There is literature on Accenture's website on this research where you can dive deeper. Monica, I'll turn it back over to you. Thank you.
Thank you so much. Thank you all for your great presentations and for sharing your thoughts. And we thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again and enjoy the rest of your day.